Thanks for tuning in for yet another edition of Dateline 360. I am Omotola Omojola. On this edition, we will be looking at the human papillomavirus. In case you don't know, HPV is the major cause of cervical cancer and has also been noted as the cause of some other cancers like penile and anal. Health experts, however, say that not all HPV infections lead to cancer. But the saying, better safe than sorry, fits the reasoning behind knowing and acting to prevent the infection. The federal government on October 24, 2023 launched the human papillomavirus vaccine in Nigeria with a target of vaccinating 7.7 million girls between the ages of 9 to 14 years across the country. Health correspondent Oluseyi Adeagbo brings us pertinent details about the process and the long-term impact on the populace.
Human papillomavirus (HPV) is a commonly transmitted infection that can lead to various health issues, including cervical and anal cancers, among others. And Nigeria, in the HPV Information Center, has a population of more than 60 million women aged 15 years and older who are at risk of developing cervical cancer. In the US CDC reports, HPV vaccination works extremely well, as the jab has the potential to prevent more than 90% of HPV attributable cancers.
85% of adults are exposed to having the infection at one point or the other in their lifetime, and that 95% of this cervical cancer are caused by the human papillomavirus. Hence, the need for prevention, which we always say is better than cure. And so, the HPV vaccine that we to introduce in Nigeria will prevent our girls from being infected with the virus. And of course, what this means is in the future, we see a generation of girls that are better protected against cervical cancer.
Since the HPV vaccination was first recommended in 2006, infections with HPV types that cause most HPV cancers and genital warts have dropped 88% among teenage girls and 81% among young adult women.
For now, we are going for age 9 to 14. It's expected that they are not yet exposed to sexual activities. And so if they receive the vaccine, they'll be protected and they don't get infected with human papillomavirus. So what we're doing now is by the time you give the vaccine, we are protecting that generation. It doesn't mean that other age group cannot be given the vaccine. But for now, that age group is what we are looking at because we want to prevent them early. Like I said earlier, in US, UK, it's for both boys and girls. They have enough vaccines. We don't have enough vaccine in Nigeria. That's why we are starting with the girls. Like I said, in another 3 to 5 years, we will, when we have enough vaccines, we'll also give to our boys. So the vaccine is not just for girls. And it's unfortunate sometimes we hear people make statements, oh, it's for sterility, for the girl child will not be able to deliver. Those things are stories. We have people who have taken the HPV vaccine. They are today grandparents.
In October 2023, Nigeria launched the vaccine to roll back the prevalence of HPV, and the launch formally introduces the vaccine into the routine immunization schedule in all the 36 states and the FCT.
The HPV launch needed two things in place, right? One, basically, is the vaccines available, and we have the vaccines available. More than 5 million vaccines were available for Nigeria and distributed to the states, and as well a strong mobilization campaign and commitment. Most of the states have been able to do that, and they have been rolling out a successful campaign. I am glad to share today with you that more than 3 million young girls, 9 to 14 years old, they have been already vaccinated against HPV. So it's really incredible. The uptake, more than 3 million girls have been vaccinated since the 24th of October in the last few weeks.
While players in Nigeria vaccination program look forward to seeing a successful implementation, drivers of the program have also been speaking on how the vaccines will help in saving lives and be of immense value to reducing the burden on the healthcare system. In Abuja, Oluseyi Adeagbo for Dateline 360.
Still on the quest for knowledge about the human papillomavirus, Chinyere Fesi Okoye In our next report brings more insight into the virus, the vaccine, as well as the response in Anambra State.
Findings reveal that human papillomavirus (HPV) is the most common sexually transmitted infection worldwide. HPV infection is a viral infection that commonly causes skin or mucous membrane growth, that is warts. Some can cause cervical cancer, among others.
Is that the most terrible and dangerous strain of the virus is responsible for the cancer of the cervix, cancer of the vulva, cancer of the penis, and other genitalia. So for those ones, it can easily be noticed. Quite unlike some symptomatic viral infections like gonorrhea, when people contact it, they know they will go for treatment. But because often this one is not symptomatic, people do not know until much later in their life when it start causing some other problems like, of course, the ones we are talking about, and then the cancers. So it's one of the commonest sexually transmitted infection, and you can count the number of sexually active men and women that do not have the virus.
Experts add that with over 100 types of HPV, its vaccination will go a long way in preventing the spread.
Since it is sexually transmitted, it can be transmitted from man to woman and woman to man. Therefore, if you want to eliminate it, the cure has to be on both sexes. It doesn't cause infection. And I think it's one of the mildest vaccine, because even people that took it, the inflammatory effect that follows most immunizations is very much less, in human papillomavirus. What is important is our people's awareness, and then the availability and cost.
What National Primary Healthcare want to do now, the Federal Ministry of Health, is to distribute it in the places that you can go and receive your normal routine immunization. So they are releasing it to the states in phases. So by next year, we're going to get our own, and at no cost to people.
As Nigeria prepares to roll out HPV vaccine across the nation, it is equally important to establish strong accountability mechanisms, including robust monitoring and evaluation framework that highlight progress.
Most often, I would say that our people, either due to ignorance or they do not prioritize things, every parent should think of immunizing their young girls before the age of about the age of 9 and 13 or thereabouts. I think that's one of the greatest package you can give your child.
How aware are people about HPV?
I don't know anything about HPV.
Human papilloma virus vaccine. Have you heard of it?
I don't think I've heard of it.
A vaccine against cervical cancer. So the last time the federal government rolled out plans to give girls of between 9 to 14 years of age. So I would say thumb up to the government for doing that.
Medical experts say human papilloma virus vaccine provides long-lasting solution or protection for the infection. But behavioral patterns should also be put into consideration. One should avoid multiple sexual contacts. In Oka, Chinyere Fesi Okoye, reporting for Dateline 360.
Like in Anambra State, the federal government's HPV vaccination program is yet to commence in Cross River State. Justina Ethim, however, reports that while the people await the mass vaccination, non-governmental organizations are stepping up in this wise.
Though accurate figures are yet to be collated for the prevalence of cervical cancer in Cross River State, giving a rough estimate, a medical expert says the state could record about 74 cases annually in women between the age 30 to 40 years and approximately 34 cases in women from 40 years and above, making the disease a contributory factor to deaths among women in these age brackets. The human papilloma virus is said to be the leading cause of cervical cancer, and this could be prevented, but the vaccines are quite expensive, beyond the reach of many. The reason the federal government launched the HPV vaccines to be extended across the 36 states of the Federation. But has the exercise commenced in Cross River states?
River State happened to fall in the phase 2 states, and phase 2 states will be implementing their human papillomavirus vaccination in the first quarter of next year. So that is actually why we have not received the vaccine in Cross River State and we have not commenced. Actually, questions have been coming from different arms and we keep telling them to be patient. So human papillomavirus vaccine is available in Cross River State, but you can only pay to get it.
The human papillomavirus vaccine is recommended for children at age 11 to 26 years. Getting this group of persons to access the vaccines would rely hugely on parents and guardians. Though a significant number of parents are aware of the vaccines, some are unaware, and this calls for adequate sensitization by relevant agencies.
My advice to parents is no vaccination should be taken for granted, no matter how it is. They should avail themselves of opportunities like this. When those opportunities come or show itself to vaccinate their children, they should catch it and vaccinate because it helps them.
So far, we don't have any reaction. After the vaccine, we give paracetamol to help reduce the pain at the injection site.
Aware of the dangers of cervical cancer, some non-governmental organizations had collaborated with the Cross River State government during the Cancer Week to vaccinate those who are eligible for the HPV vaccines.
Young girls are being exposed to all kinds of infections. So we need a lot of these interventions to stop them from the dangerous end.
Just took the vaccine now. This is just my first time taking it. At first, I was very scared. I thought it was painful, but thanks to the doctors helping us, I learned much about cervical cancer.
I have taken the vaccine and there is no reaction.
Though Cross River State is yet to access the vaccines provided by the federal government to prevent the human papilloma virus, the State Ministry of Health is already strategizing to carry out a statewide campaign sensitizing the people on the gains of the vaccines, as well as demystify the myth already conceived by many that the vaccines could lead to sterility in women. For Dateline 360, Justina Etam.
In Kano State, a total of 922,677 human papillomavirus vaccines have been launched. Hadiza Mohammed reports that, understanding the doubts of anti-vaxxers, family members of stakeholders in the state's health sector were among the first recipients of the vaccine.
Data reveals that Nigeria records about 40,000 new cases of cervical cancer yearly, with the prevalence rate increasing in Kano. The launch of 922,677 human papilloma vaccine across the 44 local government areas is an initiative that targets to reduce the number of females that die due to cervical cancer.
It is a safe vaccine. It works just like any other vaccine. Helps the body to mount an immunity in the case of infection with the human papilloma virus, which has been shown to be the causative agent for cervical cancer. And we have up to 40,000 new cases per year. In Kano, the last data we got was about 20 to 30,000 per 100,000, which is a lot. The prevalence of cervical cancer is increasing. We can see it. Before it was in older women, but now we can see it even in younger women as young as 34, 35. You see them coming down with cervical cancer, which was not the case in previous decades.
Informed by the understanding of the potential of the vaccine towards preventing girls from contracting cervical cancer, stakeholders told NTA that parents have continued to demand for the vaccine after exhausting the ones made available to the state government.
Kano have already launched the HPV vaccine campaign on 11th of November 2023, conveyed by the Commissioner of Health, Dr. Labaran Yusuf, who symbolically brought 2 of his daughters to be vaccinated in public in attendance with all the stakeholders of Kano State. The strategy for this campaign are of 3 different strategies: community, schools, and fixed post.
This is due to enlightenment through a massive campaign by all stakeholders.
We need to make advocates visit to the traditional rulers, religious leaders, and prominent people, and also youth leaders.
First phase of the vaccine campaign covers 16 states of the Federation, while other 20 states will be covered in the second phase, after which Kano State will incorporate the human papilloma virus vaccine into its routine immunization. Only few and limited studies have assessed the knowledge of in-school young persons on human papilloma virus and human papilloma vaccine. However, information is vital, as it will go a long way in helping government and other key stakeholders on how to develop, promote, and implement public health policies that will mitigate the spread of human papilloma virus among adolescents and also encourage their uptake of human papilloma virus vaccine. Hadiza Muhammad, reporting for Dateline 360.
From Nasarawa State comes a mixed grill of responses to the HPV vaccine since its launch. Victoria Ojito reports that while some parents welcome the vaccine as a preventive measure against cervical cancer, others kick against it.
Cervical cancer, a health challenge amongst women and girls of reproductive age, with mortality rate of concern to stakeholders in Nasarawa State.
The launch of HPV vaccine in the state came in handy as stakeholders believe it will reduce the burden of cervical cancer in the state. The state government adopts school-to-school approach as well as healthcare facilities to vaccinate target population of girls from age 9 to 14. Out of 172 HPV vaccine allocated to the state, the vaccination records 80% success in the state.
It is going to be routinized like any other vaccine that you know in the country. If you go to our primary health care centers across the state, if you go to general hospitals, if you go to tertiary institutions, our vaccination teams are there to administer, despite the fact that we have launched the vaccine already. So we are going to see how we can now supply the vaccine across all the health centers in the state.
There is resistance among some parents and guardians who kicked against the vaccine, while others welcomed it.
There should be a test run first. You understand? I will not allow my daughter to go and take the vaccine immediately, but there should be a test run first to see whether...
Yes, because anything health is good. At least they say prevention is better than cure. So I believe that since the health confirm it, if it is okay, it's okay by me.
I will not allow my daughter to take it. Why? Because from generation to generation we are today. And we see the side effect of virus into we Nigerians particularly. So therefore, as for me and my family, I will allow them to stay the way we are.
Giving vaccine to students, and the parents called me that we shouldn't allow her daughter to take the vaccine. I said, what is the meaning of the vaccine? They say it's to prevent girls from this cancer. So I said, if it is for prevention, it's good for them.
I strongly support that. And I witnessed many people taking the vaccine, particularly in my locality. I am a class teacher. I encouraged my students to take it, and they came to my school and they done their job. I supported it.
The state government says it is engaging traditional and religious leaders to complement in advocacy campaign to allay fears of parents and guardians.
The campaign of anti-vaxxers, stakeholders believe, also affects the response rate. There is need for sustained awareness campaign, more so now that HPV vaccines will be part of routine immunization. For Dateline 360, Victoria Kaswa Ojito.
Prevention remains a major strategy in tackling the growing burden of cervical cancer in Nigeria. Kayode Oladoshu brings us the Osun State response and reports that the message of prevention is dominant.
Human papillomavirus (HPV) has been linked to more than 90% of cases of cervical cancer. Over the years, cervical cancer, an instant lethal disease, has negatively impacted several women. Yet, not all women are informed of the possible dangers of not getting proper awareness of the disease. With a giant stride taken by the federal government to tackle this silent pandemic in Nigeria, through the vaccination of adolescent girls between age 9 and 14 against human papillomavirus in the country, Osun State government is not left out with an immunization program for the young girls in various communities within the state.
Vaccines have readily been coming into the state, and we have been deploying them accordingly, for the use of the population between the ages of 9 and 14. Which are school age. And the reason for selecting that particular age is because we want to catch them young. That is, during that time, most of the Nigerian kids are not believed to be sexually active yet. So once we are able to catch them at that particular level, it becomes easy to control and easy to manage.
Although the vaccination is not on a routine basis across health facilities at the moment, what urgent measures are put in place as advocacy to campaign for HPV vaccine amongst women and girls?
The major challenge is women don't tend to do regular checkup. There's what we call pap test. There's something we call visual aesthetic inspection. So if women of reproductive age are admonished to actually go all out to do comprehensive medical tests, which of course should include the test for to test for HPV.
We have been able to do a lot of advocacy to their leaders, the community leaders, the urbans, religious leaders, to encourage them and to reassure them that there's no way the government can bring something that will reduce our population. We won't do that. But it's for us to be able to curtail this menace of human papillomavirus that's causing the cervical cancer.
I will advise parents and the children to know that there is a lot of benefit if they make themselves available for the vaccination, because down the road, this HPV they will contract it through sexual kind of exercise, and that the possibility of them dying of cervical cancer as a woman is almost totally removed if they take this vaccination.
Cervical cancer is being ranked as the third most common type of cancer among Nigerian women and the second leading cause of cancer-related death in the age group of 15 to 44. It is pertinent to agree with the position of medical experts that vaccination of adolescent girls with HPV vaccines before the onset of sexual activity is the most effective long-term intervention for reducing the risk of developing cervical cancer. In Osogbo, Kayode Oladoshu for Dateline 360.
If the vaccine is rolled out in your state, the appeal is to allow the young ones take it. Imagine what Nigeria would be like if government did not avail many of us the wild polio vaccine. Please think about it. I am Omotola Omojola, and from all of us at the NTA, I say stick to what is good. God bless Nigeria.